Women are getting pregnant when they weren't expecting it, and social media has already given these pregnancies a name: Ozempic babies. Some women say they struggled with irregular periods for years. Others believed pregnancy was unlikely. Then after losing weight on medications like Ozempic, Wegovy, Mounjaro, or Zepbound, the pregnancy test suddenly turned positive. But here's the question. Almost nobody on social media is explaining properly. Is the medication actually increasing fertility, or is something completely different happening inside the body? Take Sarah, 31. For years, her periods were unpredictable. Some months, they came late. Other months, she wasn't even sure whether she had ovulated. After several months on a GLP-1 medication, Sarah lost weight and her periods became more regular. Then one morning, her period didn't come. A pregnancy test showed 2 lines. And Sarah immediately asked the same question thousands of women are now asking online: did Ozempic make me pregnant? The answer is not as simple as TikTok makes it sound, because Ozempic is not a fertility drug. But changes happening in the body during weight loss may change a woman's chances of becoming pregnant, sometimes without her realizing it. And if you're taking one of these medications, especially if pregnancy is possible in your future, there are a few things you need to understand before you see those 2 lines. What are Ozempic babies? First, Ozempic baby is not a medical diagnosis. It's simply a social media nickname for pregnancies reported by women who are using medications such as Ozempic, Wegovy, Mounjaro, or Zepbound. These drugs are commonly discussed as GLP-1 medications, although some work through more than one hormone pathway. They can help control blood sugar, reduce appetite, and produce significant weight loss. But they are not approved fertility treatments. So let's return to Sarah. Before losing weight, Sarah's menstrual cycle might come every 40, 50, or even 60 days. Sometimes she wasn't sure whether she was ovulating at all. After losing weight and improving her metabolic health, her cycle became more predictable. And that's where things can change. Why weight loss may affect fertility. Body weight, insulin resistance, hormones, and ovulation are closely connected. For some women with obesity, metabolic problems, or conditions associated with irregular ovulation, weight loss can improve metabolic health. And when metabolic health improves, menstrual cycles may become more regular. For Sarah, that might mean something very important. Ovulation started happening more consistently. Before treatment, she may have assumed pregnancy was unlikely because her cycles were so irregular. But once regular ovulation returned, pregnancy became possible. This is why the phrase, "Ozempic made me fertile," can be misleading. The medication isn't acting like a fertility drug. Instead, changes in weight and metabolic health may indirectly improve the conditions needed for ovulation in some women. Sarah's biggest mistake. Now imagine Sarah was using birth control pills. She sees videos online saying, "Ozempic makes birth control stop working." Naturally, she panics. But this is where social media often oversimplifies the story. The warning isn't identical for every medication. Semaglutide, the ingredient in Ozempic and Wegovy, does not carry the same specific oral contraceptive warning as tirzepatide, which is used in Mounjaro and Zepbound. Tirzepatide slows stomach emptying and can affect the absorption of oral hormonal contraceptives. Women using tirzepatide may be advised to temporarily add a barrier method or switch to a non-oral contraceptive after starting treatment and after dose increases. So Sarah shouldn't assume that every GLP-1 medication behaves exactly the same way. She should check the exact medication she's taking with her doctor or pharmacist. What if Sarah actually wants a baby? Now change Sarah's story slightly. Suppose she and her partner decide, "We want to start trying for a baby." Sarah should not simply stop contraception tonight and continue taking semaglutide. Semaglutide remains in the body for quite a long time. Current prescribing information recommends stopping semaglutide at least 2 months before a planned pregnancy. So Sarah would ideally talk to her healthcare provider before trying to conceive. Her doctor might review her medication, her blood sugar, her menstrual cycle, her nutritional status, and her overall pregnancy plans. And if Sarah has type 2 diabetes, this conversation becomes even more important. She shouldn't simply stop diabetes treatment without an alternative plan. Poorly controlled blood sugar during pregnancy can create serious risks for both mother and baby. So the goal isn't simply stop Ozempic. A goal is create a safe pre-pregnancy treatment plan. What if Sarah discovers she's already pregnant? Now imagine Sarah didn't plan the pregnancy. She took her medication last week. Today her pregnancy test is positive. Her first reaction might be fear. Have I already harmed my baby? This is exactly where women need balanced information. Human pregnancy data involving semaglutide and similar drugs are still limited. Early observational research has not demonstrated a clear large increase in major birth defects after accidental early exposure. But that does not mean these medications have been proven safe during pregnancy. Animal studies have raised concerns, and there simply isn't enough high-quality human evidence yet. So Sarah shouldn't panic, but she also shouldn't ignore it. She should contact the clinician prescribing the medication and her pregnancy care provider promptly. They can review when she took her last dose, why she was using it, and what treatment she needs next. Pregnancy is different from weight loss. There's another issue Sarah needs to understand. Before pregnancy, she may have celebrated every kilogram she lost. But pregnancy isn't a continuation of a weight loss program. A developing baby needs adequate nutrition, and appropriate pregnancy weight gain is normally expected. Weight loss medications are generally not used simply to continue losing weight during pregnancy. Sarah may also notice her appetite changing after stopping treatment, and some women may regain weight after discontinuing GLP-1 therapy. That's another reason nutritional and medical support can be useful before and during pregnancy. The bottom line. So let's go back to Sarah's positive pregnancy test. Did Ozempic secretly turn her into a more fertile woman overnight? No. But if losing weight improved her metabolic health and restored more regular ovulation, her chance of becoming pregnant may have changed. That's a very different explanation. The pregnancies behind the Ozempic baby trend are real experiences, but the idea that Ozempic itself is a fertility treatment is misleading. If you're taking a GLP-1 medication and pregnancy could be in your future, don't wait until you see 2 lines on a pregnancy test to start asking questions. Talk with your healthcare provider about contraception, your specific medication, blood sugar control, nutrition, and when to stop treatment before trying to conceive. Because Sarah's most important lesson isn't that Ozempic creates babies. It's that your fertility can change when your health changes, and pregnancy planning should begin before the positive test.